Hey everyone. Well, it's been 6 weeks since this coronavirus has disrupted our lives in so many ways. I know we are all getting tired and restless and frustrated and yearning for answers and a clear plan for getting back to normal. I want everyone to know that there are many reopen plans being proposed and communicated across our nation. This includes our federal government, it includes the Midwest Regional Group that I talked about last week, as well as the state of Michigan and regional and local coalitions within the state of Michigan. So I want you to know that there is not one of these plans that will give us our clear blueprint of moving forward. All of these plans taken collectively will help drive Life Circle's specific plan. We have to analyze all the information from all of these different plans and make the best decisions based on data for the communities we serve right here in West Michigan. The latest information shared by our local health systems suggest that the surge of COVID-19 cases will not be until July 1st. So we've identified a framework for reopening the day centers and returning to full operations. The key word here is framework. I can't even really call it a plan. Please understand that we cannot commit to specific timeframes or dates because we must be able to respond to our local community needs and demands. There are two things that need to be in place before we can develop a more specific plan. The first is that the governor's order has to be modified or lifted in order to allow for non-essential businesses and functions to reopen. The governor should be speaking Friday afternoon, and hopefully we'll have more information about the status of the executive order. Secondly, our local community infection rates must be stable as evidenced by several different indicators. So there's a lot of indicators out there, but primarily they focus on three different domains: symptoms, cases, and hospitals. There has to be a downward trajectory within a 14-day period for influenza-like illnesses and COVID-like syndromic cases. There has to be a downward trajectory of documented cases within a 14-day period for COVID-19, or a downward trajectory of positive tests as a percent of the total tests within a 14-day period. And then lastly, our hospitals have to be able to treat all patients without crisis care, and there has to be a robust testing program in place for all at-risk healthcare workers, including emerging antibody testing. So Life Circle's leadership will continue to monitor all the available information and notify you when a firm date is established to begin our plan for reopening. It will likely happen in the following phases. First thing we'll do is bring IDT members back to the PACE centers. And the IDT members are those who represent the 11 required disciplines for IDT based on the PACE regulations. So that's our nurses, dietitians, rec therapists, social workers, primary care providers, physical therapists, occupational therapists, the day center supervisors, home care coordinators, transportation supervisors, and then the directors of IDT operations. We'll have them start coming back at 8 a.m., just like normal. And when they're at the center, they'll have to wear homemade masks at all times. Staff will screen themselves every morning, and they'll need to sign in confirming that they are symptom-free. Meetings will be held in areas that allow for 6 feet of physical distance. Workstations have to be set up so that there's 6 feet of distance between coworkers. And then after required meetings and care coordination work is completed at the office each day, staff will probably be able to return home to continue their work remotely if they're not out and about seeing participants in the community. Staff members who aren't one of the required 11 IDT disciplines will continue to work remotely and be deployed when needed for essential visits. Direct care staff will continue to provide needed care in participant homes as directed by their supervisor. All staff will continue to monitor for symptoms daily and report any illnesses or symptoms to their supervisors. And all staff will continue to be paid for scheduled hours. We will be required to track hours worked versus hours paid under the pandemic pay code, as we've been doing the last couple weeks. Participant care. So the team will conduct assessments for those identified at highest risk in the community. This assessment will help the team determine appropriate support needed to maintain safety, including day center attendance. Home visits will continue to be for essential purposes only. Participants will continue to be screened for symptoms at each home visit. For participants requiring home visits, we will try to make sure that only one IDT staff member is assigned to a participant so that there's a less of a exposure risk for multiple people. Home care will continue to be limited to personal care and supervision needs, and homemaking will remain on hold. And then the assessments and reassessments will continue to be done remotely whenever possible. Day center opening. Day center attendance will not begin until at least 2 weeks following the IDT staff's return to the PACE centers. Again, this will only occur when local data suggests it's safe to allow our high-risk seniors to be out. We will not simply return to the previous schedules for day center attendance. Instead, only participants assessed to have the highest health and safety needs will be prioritized for day center attendance. And then we have to make sure that when people are coming to the day center that there's ample space. So the number of participants allowed in the building at one time will be determined by available square footage, because we have to be able to maintain 6 feet of physical distance between participants. The number of CNAs and activities assistants and other day center staff will be determined by the level of care and supervision needed by the participants who are at the center on any given day. Bus transports. They will have to have a CENA ride on every bus because every participant will need to be screened prior to loading the bus. Buses will have limited riders to maintain 6 feet of distance between participants. Participants who are dropped off at the day center by caregivers will be screened for symptoms upon arrival. The shower facilities at the centers will remain closed for the foreseeable future. And you will all be expected to help with infection control cleaning throughout the PACE center every day. And then lastly, visitors to the centers will be limited to essential purposes only. As of today, this is as much detail as I can possibly provide you regarding the status of reopening Life Circles. My hope is that our trajectory declines and we will move along sooner than later. But realistically, I think it's going to be a long summer. So me giving you a specific date when this will all be over sort of feels like I am in my front yard trying to throw a dart over my house to hit a water balloon that's in my backyard. Hey, wait, my son did that yesterday.
You hit it! No!
He obviously got lucky, so please don't expect that from me. Bless you all, have a great weekend, and thank you for continuing to work so hard and be a wonderful team.